Hi there. Have you been experiencing frequent headaches, blurred vision, or a sense of pressure in your chest? If you're over the age of 60, these symptoms might not just be a part of aging, they could be signs that your blood pressure is too high. High blood pressure, or hypertension, is one of the most common health issues in seniors. Often called the silent killer, it usually shows no obvious symptoms until it leads to serious complications like stroke, heart attack, or kidney damage. The risk increases with age, especially if left unmanaged. The encouraging news is that research shows certain natural drinks, when incorporated into your daily routine, can help regulate blood pressure levels, supporting improved heart function and circulation over time. In this video, we'll introduce you to 3 simple doctor-recommended drinks rich in nutrients like potassium, antioxidants, and anti-inflammatory compounds, which have been proven to support healthy blood pressure, especially in older adults. Before we begin, please like and subscribe to Golden Aging Health to get reliable tips that help you stay healthy, active, and informed as you age. Let's start with the first drink, scientifically known to support blood vessel relaxation and help your body manage pressure more efficiently.
Drink number 1. Reed beetroot juice to naturally lower blood pressure. Beetroot juice is rich in natural nitrates. Once consumed, the nitrates in beetroot juice convert into nitric oxide, a vital molecule that relaxes and dilates blood vessels, improving blood flow and lowering the pressure on artery walls. This is especially important for older adults, whose arteries tend to stiffen and narrow with age, restricting circulation. By expanding and softening these vessels, beetroot juice reduces vascular resistance and supports healthier blood pressure levels. Beyond its vasodilatory effects, nitric oxide also has anti-inflammatory and antioxidant properties that protect blood vessel walls from damage caused by oxidative stress and chronic inflammation, 2 major contributors to cardiovascular disease and stroke. A 2015 study published in the journal Hypertension showed that drinking just 1 cup, about 250 milliliters of beetroot juice daily for a short period, could lower systolic blood pressure by 4 to 10 millimeters of mercury in older adults with hypertension. Mrs. Linda, 68 years old, had been taking medication for high blood pressure for years, but still often felt tired and worried about her heart health. Following her doctor's advice, she started drinking a glass of fresh beetroot juice mixed with a bit of apple juice every morning to improve the taste. After about a month, her blood pressure readings improved significantly. Along with better numbers, her fatigue decreased and her mood became more positive. Her doctor confirmed that the beetroot juice helped improve her vascular health by relaxing blood vessels and reducing inflammation, thanks to the nitric oxide produced from the nitrates in beetroot juice. If you want to incorporate beetroot juice into your diet, here are some tips. Mix beetroot juice with apple or carrot juice to mellow the earthy flavor. Drink it on an empty stomach in the morning for optimal nitrate absorption. Combine beetroot juice with leafy greens and fruits in smoothies for added nutrients. Store fresh juice in the refrigerator and consume it within 24 hours to maintain nitrate levels. Have you tried beetroot juice before? What's your favorite way to prepare it? Share your tips and recipes in the comments. Up next, I'll introduce a soothing herbal tea that helps reduce blood pressure and supports heart health gently but effectively.
Food number 2. Hibiscus tea, a natural weapon for blood pressure control and fluid balance.
When it comes to herbal remedies that truly make a difference, hibiscus tea is a standout star, especially for seniors looking to manage high blood pressure and reduce fluid retention in a safe, natural way. This ruby red beverage, derived from the dried petals of the Hibiscus sabdarifa flower, isn't just a soothing drink, it's a functional health ally, backed by science and widely recommended by integrative health professionals. What makes hibiscus tea so powerful? The answer lies in its rich concentration of anthocyanins and organic acids, compounds that not only give the tea its vibrant color, but also deliver profound cardiovascular benefits. One of their most important roles is promoting vasodilation, the widening of blood vessels. They do this by enhancing the body's production of nitric oxide, a molecule that signals smooth muscle relaxation in the arteries. As the vessels relax and expand, resistance drops and blood pressure decreases. This is especially vital for older adults, whose arteries naturally stiffen with age. In addition to its effects on blood vessel health, hibiscus tea acts as a natural diuretic, gently stimulating the kidneys to excrete excess sodium and water. This process reduces blood volume and alleviates swelling, particularly in the legs and ankles, a common complaint among older adults with poor circulation, venous insufficiency, or mild heart issues. Unlike pharmaceutical diuretics, hibiscus does this without depleting potassium, a mineral crucial for muscle and heart function. The evidence supporting hibiscus tea is substantial. A landmark clinical trial published in the Journal of Nutrition, 2010, found that participants with mild hypertension who drank 3 cups of hibiscus tea daily for 6 weeks experienced a significant reduction in systolic blood pressure, averaging about 7 mmHg, compared to those drinking a placebo. This kind of drop is meaningful. Even a 5 mmHg reduction in systolic pressure can cut the risk of stroke by 14% and heart disease by 9%, according to data from the World Health Organization. But the benefits of hibiscus tea don't stop there. Research also suggests that it may help lower LDL cholesterol and increase HDL cholesterol, improving lipid profiles and reducing the risk of arterial plaque buildup, atherosclerosis. Combat oxidative stress through high levels of flavonoids and phenolic compounds, protecting blood vessels from damage. Support liver health by enhancing detoxification enzymes and reducing fatty liver markers. Balance blood sugar levels by improving insulin sensitivity, especially in people with metabolic syndrome or prediabetes. Its anti-inflammatory properties further reduce chronic low-grade inflammation, a root cause of many age-related diseases, including hypertension, kidney decline, and cognitive impairment. Dr. Emily Johnson, a cardiologist who works extensively with older patients, shares, "What I love about hibiscus tea is that it offers a multi-pronged approach, lowering blood pressure, reducing swelling, and supporting heart and kidney function, all in one simple, enjoyable drink. And the best part is, most people tolerate it very well, even those on medications." For seniors ready to make hibiscus tea part of their lifestyle, here are some helpful tips. Brew 1 to 2 teaspoons of dried hibiscus petals in hot water for 5 to 7 minutes. Enjoy it hot or cold, depending on the season. For added taste and nutritional benefit, combine with lemon juice, a natural source of vitamin C that enhances antioxidant absorption. Brew 1 to 2 teaspoons of dried hibiscus petals in hot water for 5 to 7 minutes. Enjoy it hot or cold,
depending on the season.
To make a naturally sweetened version, infuse with a cinnamon stick or a few slices of apple which add flavor without the need for sugar. Avoid drinking it on an empty stomach if you're prone to acid reflux or have a sensitive stomach. Caution: hibiscus may mildly lower blood pressure. Seniors already taking blood pressure medications should consult with their healthcare provider to avoid interactions or excessive hypotension. In summary, hibiscus tea is more than just a pretty drink. It's a science-backed, doctor-recommended, and culturally beloved beverage that supports circulatory health, fluid balance, and overall vitality, making it a smart addition to any senior's daily routine.
Drink number 3. Pomegranate juice, the natural ally for blood pressure and heart health. Let's talk about David, a 70-year-old retiree who'd been managing high blood pressure for years. Even though he was taking his prescribed medications, he still often felt fatigued, and his doctor warned him about the long-term risks of uncontrolled blood pressure. Wanting to support his heart health naturally, David began looking into dietary options. And that's when his physician suggested trying a daily glass of pomegranate juice. Pomegranate juice is packed with potent antioxidants such as polyphenols and punicolagens, which play a vital role in reducing inflammation and shielding blood vessels from oxidative stress and damage. Its primary function lies in boosting the body's production of nitric oxide, a key molecule that relaxes and dilates blood vessels. This vasodilation improves blood flow and helps lower blood pressure by reducing the resistance against which the heart must pump. Beyond this central effect, pomegranate juice also enhances the elasticity of arteries, preventing stiffness that commonly develops with age. These combined actions contribute not only to better blood pressure control, but also to lowering the risk of serious cardiovascular events like heart attacks and strokes, promoting overall heart health and vascular resilience. After just a few weeks of drinking about 150 to 200 milliliters, roughly 5 to 7 ounces of pomegranate juice each day, David noticed tangible improvements. His blood pressure readings became more stable, he felt more energetic, and his doctor was impressed with the improvement in his vascular health. Scientific studies support David's experience. Research published in journals like Clinical Nutrition and Atherosclerosis has shown that regular pomegranate juice consumption may significantly lower systolic blood pressure and reduce markers of oxidative stress in the blood vessels. It also helps protect the endothelium, the delicate lining of your arteries, preventing long-term vascular damage that contributes to hypertension. Moreover, pomegranate juice may slow the progression of arterial plaque buildup, atherosclerosis, helping to keep blood vessels open and flexible. This is especially important for older adults who are at increased risk of arterial narrowing due to age-related changes and lifestyle factors. However, pomegranate juice isn't for everyone. It may interact with certain medications, particularly blood pressure drugs or blood thinners. That's why it's important to check with your healthcare provider before making it a regular part of your diet. Here are some easy ways to include pomegranate juice in your routine. Drink a small glass, unsweetened, with breakfast. Mix it with water or sparkling water for a refreshing drink. Use it as a base in smoothies for an antioxidant-rich boost. Add fresh pomegranate seeds to salads or yogurt bowls for extra fiber and nutrients.
Let's quickly recap the 3 doctor-recommended drinks that can help seniors manage high blood pressure and support better heart health. Hibiscus tea, a vibrant ruby red herbal tea rich in natural compounds that relax blood vessels and reduce blood pressure. It's a gentle, caffeine-free way to support your cardiovascular system. Beetroot juice, packed with dietary nitrates that naturally convert to nitric oxide, helping widen arteries, improve circulation, and lower blood pressure levels over time. Pomegranate juice, loaded with powerful antioxidants like polyphenols and punicolagens that reduce inflammation, protect blood vessels, and lower systolic blood pressure with regular use. These drinks aren't miracle cures, but they're small, enjoyable additions to your daily routine that work with your body, not against it. They can enhance the effects of your medication, protect your heart, and make you feel more energized and balanced. If you or a loved one is dealing with high blood pressure, start by swapping out sugary or high-sodium drinks with one of these options. But always talk to your healthcare provider, especially if you're on medication or managing a chronic condition. Enjoyed this video? Don't forget to like, share, and subscribe to Golden Aging Health for more expert-backed tips on natural wellness and graceful aging. And be sure to check the description box below. We've included links to more helpful videos on heart health, circulation, and healthy drink swaps. Thank you so much for watching. Remember, every sip you take for your health today brings you one step closer to a stronger, longer, and more vibrant life. See you in the next video.